Firstly, Lanre, thank you for accepting our invitation. This interview aims to explore how pharmacy professionals like you are contributing to universal health coverage, health system strengthening, and monitoring future pharmacy leaders. Okay. Now we need to talk about your background and motivation. Could you please tell us about your journey into pharmacy and what led you uh, to global health section?
Okay, thank you, Tariq, for the invitation, and thank you to FIP ECPG for having me. For me, I am Lanre for short. I have my bachelor's in pharmacy from Obafemi Awolowo University in Nigeria. I have my master's in global health from Queen Margaret University, sponsored by the Commonwealth Scholarship. In my past experiences, I have about 4 years volunteering with IPSF and now with FIP CPG, where I currently serve as the Leadership Development Coordinator, coordinating the Leadership Development Program of FIP CPG. In some of my previous roles, I've worked as a pharmacist in the hospital, primary healthcare, and community settings. My most recent role was at the World Health Organization, where I worked as an intern in the access to medicines and health products division, contributing to increasing access to medicines and essential health products globally. Regarding my career journey, my journey to pharmacy all started as a teenager. As a teenager, I felt quite ill and I had to use a number of medicines for a prolonged period of time. And there was this particular medicine, it was so tiny, but anytime I took it, it relieved me of so much pain. So I was always intrigued, I was fascinated that how can something so small bring so much relief? How can something, this in quotes, miracle medicines, because that was how they made me feel then, bring so much comfort. I really wanted to understand what was the process of making the medicines, what was the process of putting it together, how did they know how it was going to work, if it was going to work. So that was what stirred my interest in pharmacy. And then over time, graduating through pharmacy, I started practicing in the hospital community primary healthcare setting. And I observed in the primary healthcare, I practiced in Nigeria. So someone comes in with possibly malaria, right? Or a food or waterborne infectious disease. The person gets treated. The next person comes in with the same disease. And I see the environment and I'm like, if one policy can be properly implemented in this environment, it will stop a lot of these infections, this malaria, this foodborne, waterborne infections that are happening repeatedly. So that steered me to desire to impact health, not just as an individual level, one patient at a time, but rather at a community level, rather at a public population level. So that was what steered my transition towards global health. So that's where I am today, contributing to policies and other health interventions to improve health system strengthening strategies. Over to you.
So that's a fabulous journey, to be honest. Uh, you have worked across multiple healthcare settings and countries. How have these experiences shaped your perspective on public health and pharmacy section?
To begin, every health system around the world has its own peculiar challenges. For those in high-income countries, it may be the increasing burden of non-communicable diseases. For those in low-income countries, it could be a triple burden of both infectious, communicable diseases, and accidents. In high-income countries, it could also be growing burden of substance use, similar to low-income countries where substance is increasingly being used. So every health system has its own challenges. And working across different health systems, I've come to see that all these challenges require their own unique, tailored approach to solving them. So the strategies that may work in a particular country setting may not exactly work the same way in another country setting. But across all settings, one thing stands out, that pharmacists are key major players in the health systems, and they will continue to be key stakeholders at the primary healthcare level and also at the system and policy making level that will strategize to improve health of the population globally. So I see that pharmacies are strategically placed both across all settings in high, middle, or low income settings, right, to address the health challenges that the community faces. So this is what my experience has brought me to see how much pharmacists can increase access to medicines, universal health coverage across all settings.
What has been the most rewarding part of your work in pharmacy and antimicrobial resistance?
For me, the most rewarding part is really understanding the how and the why. For example, if there are certain infections, particularly in a region, or there's a certain trend of a non-communicable diseases. So I want to understand why is this happening and how is it happening, right? So by finding how and why, I am able to have a good evidence based or a good platform or evidence or data to make decisions or to provide recommendations or to have strategies. So for me, having the why and how is what really is fulfilling for me, because with that, the problem can be properly solved. Many problems are not addressed having identified the foundation of the problems. So when I have that foundation of the why and how, then I know the problem can be solved.
To create a laundry. Now let's shift gear a bit and talk about global health, antimicrobial resistance, and research. What are the major challenges in addressing AMR in low and middle income countries, and how can pharmacists contribute to the solution?
Antimicrobial resistance in low and middle income countries are caused by different factors. One is inappropriate antimicrobial use that happens both in the hospitals where antimicrobials are being prescribed unnecessarily for prophylaxis, where antimicrobials that can be given as oral medications are given as intravenous medications, even at the community level where there's a increased non-prescription use of antimicrobials, there's self-medication with antimicrobials, and also there is poor education among the population. There are challenges with health financing, because if the population cannot access healthcare because it's expensive, then they choose to visit charlatans who may sometimes give medicines without prescriptions or even sell substandard or falsified medicines, which is also a growing challenge in that region. And then there's poor regulation. So it's a number of challenges that is causing antimicrobial resistance infections to thrive in those settings. And let's not forget, for antimicrobials to even be used, there has to be some form of infection to be used for. So poor infection prevention and control strategies also influence that setting. And pharmacists can play a role across all the sectors. To begin, pharmacists in the community level can act as gatekeepers to the use of antimicrobials, right? Pharmacists need to educate the public, first of all, that antimicrobials or antibiotics in particular are not to be used for all health conditions or complaints. I conducted a research in my country, back home in Nigeria, and it revealed that there were some wrong perceptions towards the effectiveness of antibiotics. Some individuals felt antibiotics could be effective for all diseases, and some even used antibiotics from their friends or family, and many did not complete the dose of their antibiotic regimen. Pharmacists can play a key role in educating the community on why they should not do this, and helping them come to understand the consequences of what happens when they decide to stop their medication doses or to share antimicrobials, with family and friends. Then at the hospital or other health settings where they interface with health professionals, pharmacists know best about antimicrobial regimens, which class of antimicrobials may be most suitable. So there is the space of collaborative prescribing, where pharmacists can contribute to how antimicrobials are prescribed at the hospitals, right? Pharmacists could contribute to interventions like the listing penicillin allergies. A lot of penicillins are in the access group of antimicrobials where you use the aware categories, and they're mostly preferred to be used if their efficacious, but sometimes some penicillin allergies are wrongly stated. So pharmacists can come into that space. Then another is the supply chain, substandard and falsified medicines. Pharmacists can contribute to addressing AMR by detecting substandard and falsified medicines. So pharmacists can contribute to the supply chain by either checking for the packages to see if the wordings are right, if the spellings are right, checking for physical errors, or even conducting some simple tests like dissolution tests when the medicines arrive, or through the national regulatory bodies, conducting comprehensive tests to detect these substandard and falsified medicines. Lastly, I would say pharmacists could contribute by disease surveillance, right? Surveillance on antimicrobial resistant trends. If you're observing lots of trends in a region, it's important to report it to the surveillance network, or also keep tracks of those trends so you know what antimicrobials are more effective in this setting. And also by using point of care testing, for example, C-reactive protein kits. With the advent of AI and technology, pharmacists can use point of care testing to identify or differentiate between viral and bacterial infection. Many antibiotics are used for upper respiratory tract infections that may be viral. So by using point of care testing to differentiate between viral and bacterial infection, they can potentially reduce antibiotics that are being prescribed for wrong indications or even viral indications that are self-limiting and may not necessarily need an antimicrobial. So these are some areas I see pharmacists coming in AML.
That's a great explanation, in fact. And now I will need to ask about pharmacists. How can they be contributed to the national infectious disease response strategies, and how can they uh, integrate it with these strategies? If you have a lot of ideas about that.
For infection disease strategies, that's where infection prevention and control really comes in, right?
Exactly. Exactly.
So pharmacists, first of all, can create awareness on the importance of sanitation and hygiene. Pharmacists can go into the communities to steer behavioral change. Pharmacists are the most trusted health professionals. In many low and middle income settings, even before the people go to the hospitals or even to the primary health setting, many go first to the pharmacist, right? So at that primary point of contact and building on that trust, pharmacists can play a big role in infection prevention and control, educating the communities on why they should not do or engage in certain acts and why certain myths or wrong beliefs should be cast out. In some regions, they have certain beliefs, possibly religious or cultural, that may be stimulating lots of infections around those regions or in the people that believe or practice those things. And it's important that pharmacists can come in with our knowledge of medicine and our trust and also our communication skills. Pharmacists are excellent communicators. When they speak to their patients or their clients, they can convince them to change their behaviors to do the right thing. Then, second, at the policy or planning level, pharmacists can contribute based on their knowledge of what is going on at the communities. Many infection prevention and control strategies may not be planned with the community at the center. But pharmacists, because we have that interface of meeting both the communities and also the policymakers and conducting research, we can give a more comprehensive overview to infection prevention and control strategies. Then lastly, vaccination. FIP recently released a report where about 56 countries have approved for pharmacists to give vaccination. So when pharmacists are involved in vaccination, pharmacists can reach hard to reach areas, areas where there may not be a hospital or a primary health center or a GP, but there will most likely be a retail pharmacy in that area, right? And if that retail pharmacy is empowered to give vaccination, it can prevent a lot of diseases in that region. So these are some ways. I've mentioned disease surveillance previously, right? So if there's a form of disease surveillance, if it incorporates pharmacists, If pharmacists are being contacted for contact tracing, if pharmacists are also giving data on maybe the number of rising cases of infectious diseases in the region, or reporting possible suspected symptoms, they can also contribute to these strategies. So these are how pharmacists could play a very big role in addressing diseases, both communicable and non-communicable, all over the world.
That's a great ideas, and you have answered a lot of questions we have about this section. Now, I would like to explore another aspects about collaboration and mentorship. Can you share an example where cross-sector or interdisciplinary collaboration made a significant impact on a project?
For example, one example that comes to mind was still while I was practicing as a community pharmacist. One intervention was a telehealth intervention where I, as the pharmacist, could connect, some of the patients that walk into the pharmacy to a doctor via telemedicine. So they walk in and they state their complaint or the health challenges they have, and then I put them on a telemedicine call to the doctor. A particular case that came was this young man. It was quite active. He looked really fine physically, but his blood pressure was very high. So when I checked his BP was quite high. So I put him up with a doctor on telemedicine, and the doctor spoke to him. And doctor initially gave some prescriptions. He gave a diuretic and some other medicines. And I spoke with the physician and I let the doctor know that as an active young man, he may not, be the best fit to be on a diuretic because he may need to, use the restroom a couple of times, and that may impact the kind of work that he does. So I spoke with the doctor and we had a conversation over what kinds of medicines could fit his lifestyle best. And we eventually were able to come to an agreement. And it was below 40. So by that multidisciplinary collaboration, we're able to identify the increased blood pressure really quite early. It was able to see a doctor instantly, not having to spend extra finances going to a different health center or having to spend time waiting at the clinic. And we were able to put him on a good medication. Then I also gave him the appropriate counseling that he needed for lifestyle modifications. So that's one example of where a multidisciplinary approach could have worked. And that's way it helped increase like the trust in the health system in the pharmacy I was in, and so many other examples I may not be able to speak
And
about. So
sorry,
that's one
you need to.
example of how it's helped on a particular project.
And how has your mentorship influenced your career journey in both your studying and your professional pathway?
Mentorship has a big role to play in every early career pharmacist. And I do believe that everyone should have some form of mentor that they relate with. Isaac Newton, one of his quotes that I really like, he said, it may not be verbatim, but said, if I see farther than others, it's because I stood on the shoulders of giants. So there might be people that have walked a certain path you want to take. There are people that may have gone ahead in a certain field. It's important to connect with them. Mentors help inspire, mentors help guide, mentors help encourage. One thing with mentorship that I believe is first, as a mentee, you need to understand that mentorship is a two-way process. So as you receive or get benefits from a mentor, it's also important to find ways to also give back to your mentor. Another thing is for productive mentorship, having clear goals goes a long way. So when I meet my mentor, I let them know these are my goals that I have for myself, for my career over the next 6 months, over the next 1 year. These are the things I want to achieve. My mentor looks at it. Is it smart? Is it achievable? Is it realistic? Is it time bound? What are some of the challenges that you may encounter? We have a discussion around it. Then sometimes we have a plan, a course of action. So can help create that course of action. The next is accountability. it's important to be accountable to your mentors. If you have maybe some plan, some course of action, some training that you're supposed to take, or something you're supposed to do, your mentors ask you to do something that may help you achieve your goal, and you've not done it or you're falling behind, it's important to be accountable. Accountability in mentorship helps both you and the mentor to know exactly how to align your goals to what is feasible at that time. One thing that's also helped me in my mentorship journey is being vulnerable. I can remember there was a time where I was actively searching for some opportunities and it was really difficult. I was applying to a lot of places and really wasn't getting so much. And I met my mentor and I was vulnerable with him and he gave some really good advice that really helped me secure the next phase of career opportunities. So these are some ways that I mentorship has benefited me, and I do believe that it will benefit many other early career pharmacists also.
So that means there is a lot of key elements of effective monitoring programs that can empower young pharmacists to take a leadership roles. Could you please mention one or two of them?
I mentioned a couple in like the past response, so I'll just highlight them. First, set clear goals. First, set clear goals. Two, be accountable. Be accountable to your mentor, be accountable to yourself. Three, it's okay to be vulnerable with your mentors. If you're not doing something or things are not going on as you planned, let them know. And also, mentorship is a two-way thing. So as you get from your mentors, it's also good to desire to also contribute to their own progress also. Those are some elements that do work for me.
Now we need to moving to another important area and talk about innovation, equity, and sustainability. How can pharmacists contribute to making healthcare systems more equitable and resilient in underserved settings?
This is really important because underserved settings have their own unique challenges. For some underserved settings, they may be situated in regions that are hard to reach, either due to physical constraints in terms of bad roads, or they may be located on water bodies. The people living in those regions may have lower income or have lower social demographic, so they may not be as wealthy as people in other places. There might be some form of language barriers. So this half, I think pharmacists could help in those settings. First, digital health innovations. Pharmacists could help with some form of telemedicine in those settings by having digital health innovations. If possible, if they have access to mobile devices, the pharmacist could speak over the phone with maybe a community volunteer that goes into the community. The pharmacist could also work by increasing access to medicines in those settings and access to vaccination. And this is by having a resilient supply chain. So pharmacists in making medicines available could have some drought resistant or flood resistant storage systems that could help in those settings. In those settings, particularly riverine settings that may be prone to flooding, the pharmacists could integrate kind of like a flood resistant storage system where they could order medicines in that could last over a period of time and then store them and make them available to the people. Another innovation I've seen in recent time is the use of drones in delivering medicines and supplies in hard to reach areas. So pharmacists could also be involved in that. And then at the community level, pharmacists also play a major role in community health advocacy. Some people in these regions may not have access to the best information about their health or their well-being, and it's good that pharmacists utilize the opportunity to reach out to people in hard-to-reach areas with the right information. If they have the right information, they could change some of their lifestyles, and that could really impact on their health and well-being. So pharmacists could contribute by community outreaches. The last thing I would love to say is pharmacists could also contribute at the level of planning interventions in those settings. If a pharmacist has been in a underserved region and possibly there is some form of program or initiative by either the government or a non-governmental organization in that region, the pharmacist that has a good idea of the health challenges in that setting can contribute to the planning of such interventions and programs to enhance its delivery.
And what promising tools or innovations have you encountered that enhance pharmacy's role in public or global health?
Across board in the health system, I think artificial intelligence is the in thing, and it has come to stay. I've seen artificial intelligence help with drug interactions, AI trying to identify drug interactions. Artificial intelligence has also helped in point of care testing. There's an increased use of artificial intelligence in point of care testing, and that can also help pharmacists in regions where they may not have good access to diagnostic facilities to detect either infections or chronic diseases even. So that's one way I see innovation coming in. Another is the role of pharmacists is expanding globally, right? For example, in the UK, pharmacists are being involved in the pharmacy first services, where they are being certified to prescribe or to attend to certain health ailments. And that is an idea that is, increasingly being welcomed in many parts of the world because there is shortage of many health professionals, and pharmacists can bridge the gap between different health practices because we are versatile, we are lifelong learners, we are very flexible. So there is the increasing use of, for example, prescribing support applications. So some pharmacists that are opportuned or licensed to prescribe certain medications have that kind of guide on possible medical devices or even on the laptops or computers that help them in making informed decisions. So these are some innovations that I've come across and they are here to stay. Also, AI in drug delivery and drug discovery, artificial intelligence being used in developing models or even identifying possible lead compounds. That is in the drug discovery process, as seen in the speed at which certain vaccines are being developed in recent times. So these are some innovations that I think have come to stay, and pharmacists can truly leverage them, both on the short term and in the long term.
A great explanation about the ideas that we are talking about. Now we need to talk about the future of pharmacy. What do you see as the most exciting opportunities for pharmacists in advancing global health and universal health coverage?
The pharmacist is uniquely positioned in the community, in research, in policy making to improve health systems across the world. In any setting, any country you go to, pharmacists are key major players in the health system. So for the future of pharmacy, I see the role of pharmacists expanding. And as our roles continue to expand, and with the advent of advanced pharmacy practice, the Doctor of Pharmacy program being integrated across different regions and countries, and health leaders, policymakers coming to see the importance of pharmacists, I would say the first thing is pharmacists need to be lifelong learners. As our rules emerge, we need to learn and continue learning. For example, climate change has caused a shift in certain infectious disease or vector-borne diseases, where in some regions they're having cases of vector-borne diseases they have not seen or witnessed in 40 years. Some climates are becoming warmer, so they are having new diseases that they have not seen in a while. So as lifelong learners, we need to be able to learn about some of these changes as we are positioned to mitigate them. Also, technology is going to advance and more applications, more integrated technology will come around. We need to learn and be lifelong learners, be open to collaboration. The second thing I would say is increased advocacy. Pharmacists and the future of pharmacy will rely greatly on how much we are able to advocate on our impact. Pharmacists make so much impact, but sometimes we are not given the credits that we do deserve. And we need to continue to advocate for the opportunities that we bring to the health system and how well we can improve it or contribute to policies and research. The third I would like to say is pharmacists need to get involved in leading initiatives, leading either programs, projects, or interventions, both at the local, regional, and global level. So pharmacists need to take up and get involved in more roles at the systems level, not just at the patient level now, but also at the systems level. So they need to, get involved in making comments on policies. When policies are put out for public consultations, pharmacists need to speak if they see policies that may not be applicable at the local level. They can contribute to that. Associations of pharmacists, just as the FIP is strongly doing across board at the World Health Assembly, at different conferences, FIP is also always speaking for pharmacists. So pharmacy associations at the local level also need to continue that advocacy at the local level to say, hi, we are pharmacists. Pharmacists have helped in different settings around the world, and we see how pharmacists can also continue to help in this setting. So pharmacists need to continue advocacy. In many regions of the world, pharmacists may be seconded and perhaps not embraced for their full potentials, especially when other health professionals may have a stronger voice. But we as or larger numbers, because there are not too many pharmacists around the world, so we need to continue advocating for the profession. And lastly, I would say is pharmacists have a lot of soft skills that can be transferred from the clinical practice or from research to global health. Pharmacists have great communication skills. Pharmacists are researchers. We do a lot of research either in the laboratory or by interacting with patients, collecting primary or secondary data to inform health information. Pharmacists have excellent writing skills. Pharmacists have critical thinking skills because we tend to detect maybe drug-drug interactions or some form of errors in the prescription or some form of interventions that need to be implemented at the community, trying to make clinical decisions. These are critical thinking skills that we can transfer from clinical practice to global or public health in general. So pharmacists need to know that they have these skills and that their skills are important. My last word will be, as a pharmacist, your vision for an improved health system is valid. Pharmacists, we have visions. We want the communities to be better. We want patients to be better. Your visions are valid, but they are only as valid as the actions that you take. So as young pharmacists, we need to be able to mount up courage and sometimes do things afraid. You have a vision, you have a goal, you have something really stay in your heart, you are passionate about change, it's important to take the steps. We are early career pharmacists, or maybe some other pharmacists may be listening to this, but you need to take that step, right? It only gets as good as the actions that you take. So that's all for me from this interview. Thank you so much for having me.
All of you, what you are mentioned is considered duties and responsibilities for the pharmacist. Now I need your advice to the early career pharmacists who aspire to work in global health or lead health system transformations.
Okay, for pharmacists that do want to work in global health, what I would say is sometimes shifting into a more global or public oriented space, if one is just moving out of maybe the university or out of a patient centered practice, can come with a lot of uncertainties. How do I start? Where do I work? What kind of job opportunities are there? I think the first thing to do is take courses, take some form of training on public health or global health. So if you can find some courses online on health system strengthening, some courses online on improving population health, some courses online on, for example, antimicrobial resistance, if that's what you're also passionate about, like myself, or some other areas, if you're passionate about non-communicable diseases, you can take some population or global or public health courses along that line. That can help introduce you to how programs are planned, to monitoring and evaluation strategies, and to how communication is in public health space. The second thing is attend conferences. There might be a public health conference in your region or your country, or a global health conference. Attend the conference, meet people, network with them, let them know that this is what I'm interested in. I'm a pharmacist. There may not be so many pharmacists in that space, but don't be scared if the people you meet are possibly, across different professions, because public health, global health, you have people across different professions, people from the social sciences, people from the medical sciences, people from the biomedical sciences, people from behavioral sciences, all working together. It's a very multidisciplinary space. So you might meet people from other professions, but don't worry if that's what you're interested in. Be bold about the fact that you're a pharmacist, right? And attend those conferences. Let them meet with people, network with people. The next thing I would say is read literature on what you're interested in, right? If you're interested in rules around certain diseases or programs, go and find some literature around those programs or some organizations that are working on those programs. You could ask ChatGPT to give you a list of organizations that work on certain programs in your country, right? Or AI, any form of AI tool. You can have a list of organizations that work around that. Go and read about those organizations, read about what they do, read about some of their programs or projects. Get to acquaint yourself with more information. The more you know about transitioning, the less risky it's going to be for you, and the more or the better you can plan. So know about those organizations. The next thing is it's okay to start afresh. When you're transitioning to a new role, perhaps you might have been a manager in a clinical practice and you want to transmit to a more public health centered role. You may be wondering, do I also start at the managerial level? You may not have the opportunity to start at the managerial level. So you should explore opportunities like internships, volunteering opportunities. So it's important to explore those opportunities because they give you great insight into possibly what you like better or even what you do not even like. Because sometimes we might be interested in things we may not fully know if we are fit for or not. But those volunteering opportunities, internship opportunities could go a long way in positioning you for those spaces. Then lastly, research. As you read through literatures, you see if there's any research you can do at your local level, right? A lot of primary data can be collected. You can work with your institution. If you're working in clinical practice, you will collaborate with some people in academia or some other form of partners and conduct research. It will really go a long way in transitioning across board into global or public health rules. So these are some initiatives that I think have helped me and could help many young pharmacists out there that desire to pivot.
In fact, you had a lot of details, and if we have time, and you need to talk for all the day. Before I should closing with you, are there any topics or professionals you recommend us we spotlight in the future?
In terms of people or professionals to spotlight in the future, did I get that right?
Sorry?
You want me to highlight maybe people or professionals we can spotlight in the future?
Yes, of course.
Okay. What I would say is everyone is a potential star. So everyone listening to this you are a star, right? What you need to do is just to identify your uniqueness, identify the problem you want to solve, and focus on it. So if I were to spotlight anyone, I would say spotlight yourself. right? Put yourself out there. Let the world know what you're involved in. Let the world know what you do. Let the world know what skills you have. It can really go a long way in positioning you as the future of global and public health. The second thing I would say is there are some people that do great work across different sectors. LinkedIn is a great way to identify these people and connect with them. So you can connect with them, send them a connection request. Some may not accept. You can follow many of them. You can follow many people on LinkedIn, even if they don't accept your connection request. Follow them, get to see what some of the things they are doing. You can read through some people's profiles, get to see possibly some training, possibly a master's degree or a PhD or a professional diploma that some have undertaken that perhaps was useful to them. And you could see if you have any opportunity around you to engage in similar training programs. If depending on the availability of finances and other related factors, you could go ahead to take those courses, right? You could also look into what are some of the conferences that they lead, right? What conferences do they speak at? What are some of their past speaking engagements? You can also read on some of their papers. I think that's something that has also helped me also because some of them have some research papers. You can read about it. And if they have podcast is really growing among global and public health professionals and professionals globally. So if they have a podcast that they are featured in, you read through their profiles, maybe on LinkedIn or on Instagram, and you see that they featured in a podcast or in a conversation. You could go listen, listen in, have an idea of how they think, or possibly get one or two insights from some of the things that they see.
Mr. Landry Popola, thank you very much for your time today, and we would like to see you in another time and do an extra interview with you. Thank you very much.
Okay, that's fine. Thank you so much. It's an honor to always be here to impact pharmacists around the world. Thank you.
Thank you. You are very, very welcome.